I'm super excited. We have MJ, and I'm sorry, I'm Justine. Do you want to introduce yourself?
Yes, Heather Smith, nurse practitioner.
Thank you guys for joining us so much. I'm just going to start out and let you guys kind of like introduce yourself and tell everyone what you do.
Okay, so I'm MJ Adams, and I'm a functional medicine nutrition coach. I work with women who struggle with hormone imbalances primarily, but I also specialize in gut health, stress management, autoimmune disorders, and also weight management.
And I'm Heather Smith. I'm a board certified nurse practitioner, women's specialist, but I also treat men for hormone health. And I specialize in bioidentical hormone replacement as well as synthetic. I work on thyroid issues, autoimmune disorders, gut issues, some of the same similar things we work synergistically with, and supplements and weight management.
This is awesome. I'm excited. I'm excited to learn today because you guys know way more about hormones than I do, but also I know there's a couple people in the group that struggle with PCOS and Hashimoto's. So definitely why I wanted to talk to you guys. So what inspired you to really start working with women with hormone issues?
Well, for me personally, back in about 2015, I got really, really sick. Ended up in the hospital, and they could not diagnose me with anything. Every test turned out to be just fine. Everything was normal. And so I just remember feeling so bad and praying to God, like if he could heal me, make me feel any type of relief, that I would spend the rest of my life trying to help others do the same. Out in Austin, I lived in Austin at the time, and Austin's very big on holistic health. I met up with a well-known functional medicine doctor there, and come to find out all my issues were driven from stress. And so that's what really inspired me. I've always been really into health and fitness. I know how to diet to lose weight. But as I've gotten older, I'm in my 30s now, there's so much more to weight and what a woman wants to look like outside of just eating and working out. Like there's so much more pieces to the puzzle. There's so many women that fight. They come to me and they're like, "Oh my God, MJ, I've been eating super clean. I've been working out religiously, and yet I'm gaining weight." And it's 9 times out of 10, it's hormone related. So I just started working with women one-on-one here and there, just kind of as like a hobby. And I really realized it was something that I knew I wanted to do for the rest of my life.
And my issues were, I am actually a mom of 7. I have triplets and twins, and I was pregnant at 18, and I'm now 39. So I have a 21-year-old, a 19-year-old, 3 14-year-olds, and twin 4-year-olds. And 2 of my pregnancies, I had to do infertility treatments, which caused me to have more hormonal issues than I was already having. I also have done really rigid diets. I competed. I threw myself into low thyroid. I have insulin resistance. So I've always fought battles with my hormones. And then when I graduated nurse practitioner school in 2012, I had also just gotten married, and my husband at the time had low testosterone. And so with my issues and his issues combined, it just made me realize that that was the specialty that I wanted to go into. So I was already specializing in women, but I decided to branch off into hormones. And so I've been doing that ever since. And just being able to share my experiences with patients has really been super helpful. From infertility to pregnancy to thyroid to weight issues, all of those things have helped me help others. So that's why I'm in this field.
Those are both great stories. I'm loving this. So for someone who maybe like hasn't been diagnosed yet with any kind of hormone issues, but they think something like might be up, what are some clear indicators that there's probably a hormone imbalance that they should go get looked at?
Well, I'll answer you from a nutritional standpoint. When somebody comes to me for nutrition, I always, first of all, what I try and do is get lab work done, because a lot of their symptoms that are causing them to, either gain weight or, not feel really good. They've got a lot of brain fog, They've got skin issues. They've got weight around the midsection. What else? They've got, big time fatigue, like especially in the middle of the afternoon, whenever your energy should still be somewhat, great.
Poor sleep.
Yeah, really poor sleep habits. Even things such as anxiety, things like that. Hormonal acne along the jawline. They can't figure that. They're like, why am I breaking out so bad?
And a lot of women suffer from anxiety and depression. And then they go to see their regular primary care provider and they get thrown on an antidepressant or anti-anxiety medicine when really it's a hormonal change and it's related to progesterone deficiency. So by just balancing your hormones, you can stay off of those drugs that cause other side effects and, fix it instead of putting a Band-Aid on it. So, but PMS, mood swings, hot flashes, night sweats, and then for guys, usually it's weight gain in the midsection, erectile dysfunction, no sex drive for both men and women.
Yeah, that's a big one for both men and women.
Lacking motivation, inability to build muscle and burn body fat.
Yeah. I mean, I've suffered severe hormone issues, and I'm actually proud to say I'm very balanced now. It took me a little time to get there. It doesn't have to take a really long time. You just have to know what you need to do. And so that's where she and I, that's why I've teamed up with her, is because she's the doctor, right? I'm just the nutritionist, but with both of us working together, we can really provide an optimal result. I fought really bad estrogen dominance. I fought really low testosterone. And it's one of those things where hormone replacement for me was necessary. It's not necessarily necessary for everybody, but I like to be active. I like to work out. And I wanted to build a little bit more muscle, and my body just doesn't make testosterone like it should anymore. I went through some really stressful phases in my life, and that depleted my hormones. I mean, at the end of the day, it is what it is.
Mm-hmm.
Caused me to have really low thyroid. It's crazy because it's a domino effect. If you've got stress here and your HPA axis is not functioning properly, it leads into hormone imbalances. And then those hormone imbalances cause thyroid issues. So you may not even need to be on thyroid medication, but your doctor is going to put you on thyroid medication, right? It's necessary for a lot of people, don't get me wrong, but sometimes it's just not. And then that leads into gut issues. It's just like it's all connected. So
actually that kind of leads me perfectly into my next question. Is I feel like a lot of women, they go to their doctors with these symptoms, and a lot of doctors seem to kind of like push back on doing a full lab panel, or like not necessarily checking for all the things that they should be checking for. So do you guys have any tips on, like, one, finding a good doctor in your area, and then two, what specifically type of labs they should be asking for?
I'll take this one. So a lot of times it's because the physician's not well versed in actually treating the issue. Big pharma wants to take a role in covering that up because they are the ones that fund, the drug companies are the ones that fund the medical societies that teach the physicians. So they would rather you be sick so that they can make money off of prescriptions. So it's not that the doctor doesn't want to treat the patient. It's just that they didn't learn that in medical school. So the only ones that did would be like OB-GYNs, an OB-GYN for a female or a urologist for a male. And all they're taught is synthetic medications. So they're not taught natural ways to treat or ways to fix it from internally instead of just throwing a medication at it. So I would definitely look for somebody who does functional medicine or bioidentical hormone replacement, a natural path doctor, something like that. And then they need to do a complete thyroid panel, not just a TSH. They need to check estrogen, FSH, testosterone for women, progesterone, testosterone, a prostate antigen, and estrogen for men. And make sure, just blood counts, kidney, liver enzymes, vitamins, those kind of things are done. But
cortisol.
Yeah, cortisol is a big one. The best way to test that is at multiple times during the day because your cortisol is always changing. Sometimes you might not have access to that, but every lab can at least run a morning cortisol or a random cortisol throughout the day. So I also offer telemedicine, throughout the United States. So that's always an option. If a patient's living out of state and they want to connect with me, I can do that too.
Yeah, that's a great call out, because I feel like the next thing I wanted to say is, even if you like go and you get a panel, I know a lot of doctors will be like, oh, well, things are normal, but
Right.
normal doesn't necessarily mean that it's optimal, right?
Correct.
Like
Yes.
the
Right.
normal ranges are really wide.
Right. I explain that to my patients too, because they'll come in and they'll be like, my doctor said it was normal, but I have XYZ symptoms. And I'm like, I treat a little bit differently. I'm going to listen to your symptoms and I'm going to look at your labs and we're going to try to optimize the labs and fix the symptoms. I want to find out what the underlying cause is and treat that, not just tell the patient you're normal and you're crazy and there's nothing we can do for you. So, yeah.
This is great. So for some of the girls in the group that have PCOS, if you are working with someone, like, I know everyone's different, but from just a nutritional and training workout, like, what are some tips that you have for them?
Want to go take that first?
Sure. With PCOS, you have a lot of insulin resistance, sometimes estrogen dominance. Usually the body is more susceptible to adrenal fatigue. So I would not overdo cardio in those situations for sure. Those women do still need strength training. All women still need strength training, but you don't want to overdo it. And as far as diet, MJ will talk more about that, but as far as watching your sugars and your carbs and not completely eliminating them, but just watching the balance and making sure you're keeping your weight within a normal range and those kind of things, because those women are more prone to weight gain and other issues. So
right, yeah, and there's so many different types of PCOS. There's insulin resistance style PCOS. There's inflammatory PCOS. There's lifestyle induced PCOS, and then there's also just a hidden cause PCOS and pill induced. So there's so many different types of PCOS, and so you can treat them all very similarly, I would say, but you do have to watch the carbs. And I don't mean I don't mean put you on keto. Like I've got several clients right now that are, doing really, really well, achieving the results that they're trying, that they've been dying to achieve for so long, that have PCOS. It's a little bit of a longer course. I mean, at the end of the day, it is what it is. You do need to cut back on the workouts, because going harder is actually hurting you. And that's really anybody with hormone imbalances in general. Like if you have any type of hormone imbalance, you need to get your hormones balanced. And then once you're balanced, you can hit it hard. But sometimes less really is more. Same thing with food. We've got to make sure you're eating adequate amount of calories. So many people tend to pull back or not eat enough. I mean, that being a nutrition coach, and to nourish the hormones and nourish all the symptoms that or to alleviate all the symptoms that we're working on, especially with PCOS. Food is going to be a big deal of that.
fiber is a big
one. Yeah, fiber is really, really big deal.
That was a question that was asked about fiber.
Yeah, increase fiber to decrease insulin resistance, and to help with estrogen dominance. Basically, there's different pathways of estrogen. Not all estrogens are bad, but there are bad estrogens, and we need to eliminate those out of the body, so that we're not holding on to them. So fiber, green leafy vegetables, all those kind of things. The cruciferous vegetables like broccoli contain things called DIM, which are natural estrogen blockers, to kind of block all those excess estrogen pathways. So,
but it also helps with the insulin spike too.
Yeah.
So the fiber will help slow that down. So you're not going like this. It's like your blood sugar is not going way up and then like crashing. You want to stabilize it, and that the fiber does help with that as well.
Yeah. And then, do you often run your clients through an elimination diet?
Yes, I do. I usually put them through a flush protocol first, and it's similar for most people. I tweak the serving sizes of certain foods. It's not a juice flush. It's not anything crazy. I'm actually feeding the body up while pulling the toxins out. Because at the end of the day, it's really, the question is always, how toxic am I? because we're all toxic in some way, shape, or form. So but that diet, the diet that goes with that is very similar to an elimination diet. Yes.
Gotcha. And then you provide probably a supplement suggestions, right? One of the big questions was asked about fish oil.
I think everybody needs to be on fish oil.
That's what
inflammatory.
Whether you're perfectly healthy and normal or you're super imbalanced, everybody should be taking fish oil.
And a lot of people don't realize that you can actually take higher milligrams than what's recommended, and it's really anti-inflammatory. So,
right. That vitamin D is a big one because so many people are deficient in vitamin D.
Pretty much everybody.
Yeah. I mean, I still have vitamin D deficiency. It's gone up a lot, but I mean, it's crazy. Like it takes a lot of vitamin D for me to get my levels normal. You know?
You live somewhere that's generally like warm climate. Yeah. So people who are even further north really struggle with vitamin D.
Yeah. And you have to take it with food or it's not absorbed. I don't think a lot of people know that either.
Even actually fat, if you take it with fat, it really absorbs the best with a little bit of fat. So
I want to switch gears a little bit and kind of talk about the pill and birth control. So do you see like a large connection with the women you work with having trouble losing weight and being on the pill?
I do. And the pill is synthetic, obviously. And they're giving you estrogen in the pill, and estrogen causes your fat to hang on more into the fat cells. So of course you're going to have weight gain. Now, not everybody has weight gain on birth control pills, but I would say the majority either has weight gain or can't lose like the last 10 pounds of weight. And what that does is it screws up your hormones moving forward. So a lot of people or a lot of women will have hormonal deficiencies once they get off the birth control and not even realize it. But you go again, you don't know any different. You go to your OB-GYN and you're having all these issues, acne, irregular cycles, whatever it is. And they just hear birth control is the automatic fix because that's what we're taught in medical school. But that's not fixing the underlying cause. So there's other ways that you can fix those things without having to throw a patient on a birth control pill. So what I recommend to my patients that need birth control for birth control purposes is to do a non-hormonal IUD.
Like a copper IUD.
Yeah, I even have my 18-year-old daughter. She has an IUD and she's never even had a child. And I mean, it's the best form of birth control. She's not going to take it out. It lasts 5 years. There's some that last 10. And, I'm not giving her synthetic fake hormones. So,
have you heard of Phexxi?
Mm-mm.
So it's supposed to be a non-hormonal birth control. I just listened to a podcast. Do you know the Skinny Confidential?
I've heard of them. Yes.
So she had the doctor who helped just get this drug passed, and it's very new. And it's basically more of like a one-time use thing that you would insert it into like vaginally right before you were about to have sex, and it's supposed to be like a non-hormone birth control option. I've only like listened to a podcast about it, so I'm like, all right, I need to do some more research. But
what is it called?
Phexxi, but with a PH.
Okay.
And I think it's PHE like XXI or something.
Yeah, I'm gonna look into that. I'm always into all the newest, latest and greatest, coming out. So
yeah. So if you have someone who's like planning to come off the pill, do you have any tips for them in order to kind of like make sure they can do it in a way where their hormones just don't go crazy, just completely like eliminating the artificial hormones?
I would just have them finish their cycle of pills and then stop. They'll probably have irregular bleeding for the first 3 months, which that's completely normal. So as long as they can deal with that, that's not an issue. But what I would do is once they're off of that pill, I would then run their hormones and see what everything looks like and probably give them some natural progesterone replacement to kind of get their cycles back on track. And that's different than actually, if you go to your regular OB-GYN and they're like, oh, we're going to give you some progesterone to get you to have a period. It's not actually progesterone, it's progestin, and it's actually synthetic and fake, and it's causing more issues, push you at risk for blood clots. I mean, all kinds of things that they don't really explain to you. They're just like, here, take this pill and your periods will be regular again. especially PCOS patients who haven't had a period, they do that a lot. And so there's other ways that you can actually fix that naturally.
Yeah, there's some really great natural supplements out there. So.
Yeah, so I shared a story on my Instagram today talking about you guys coming on, and I talked about when I was like younger, I struggled with acne so hard, and I didn't want to do Accutane because they talked to me about all of the like negative side effects. But then it's like no one ever talked to me about the negative side effects of me getting on birth control. And then it wasn't until I got off birth control that like things got better. But
Yeah.
I just think it's really interesting that like those side effects of birth control, I don't feel like are really like explained to most women.
They're not. They're really not.
You know, the way that I explain it too, and one of my mentors kind of shared this with me. He's like, would you put your son, because I've got a 14 and a almost 16-year-old, and he's like, would you put your son on testosterone? I was like, hell no. He goes, it's basically saying like, it's basically testosterone, but for your girl. You know what I mean? It's like, you wouldn't do that for your son. So why would you give your daughter,
Hormones,
fake hormones at 15, 16, 17 years old. And I was like, that's a great point.
Yeah. I just think as a society as a whole, we've been conditioned to believe as women that everybody goes on birth control.
Right.
Like it's just normal. And really they shouldn't be teaching that because it's causing so many problems, even infertility. I've had two family members that couldn't get pregnant because of birth control, because of being on it for so long.
Mm-hmm.
So I don't think that, none of that's explained.
No.
Yeah.
So we do a lot of teaching here.
Education. Yeah. I'm huge on education. Even with my nutrition programs, I'm always pumping out education to my clients because I want them to understand why they're fighting what they're fighting, whether it's, hormones or PCOS or metabolic resistance, gut issues, all the things.
So if you have someone struggling with like some hormonal acne, do you have anything more on the dietary side that you would recommend? I see so often like the first thing is like, oh, just cut out dairy or like nutrition, things like that. But I'm curious what your thoughts are.
So for me personally, I'm being on the nutrition side, I definitely think I don't think dairy serves much of a purpose in diet anyways. I mean, some people can get away with it but conventional dairy causes major skin issues. But not only dairy, it's sugar and also even gluten. I've seen people get off gluten and they've had like rashes. So it's not just acne, it's like skin issues and taking the gluten out. I don't pull everything out at one time because 9 times out of 10, taking dairy out does help tremendously. Does it cure everything? No. I even have hormonal acne and I don't touch dairy, but I noticed that if I eat a little bit of dairy, I will have blemishes pop up. So yeah, I definitely recommend no dairy, no added sugars, and then gluten if those two don't work. That's what my recommendation.
And then greasy foods, obviously, like you want to watch the oils and fried foods and all those kind of things you shouldn't be eating anyway.
Yeah.
And then a supplement that I put all of my patients on for prevention of that is saw palmetto. And it comes from a plant and it decreases testosterone receptors on the skin and blocks a byproduct called DHT. So that has been super helpful. And then if that's not enough, we also do prescription medications that are helpful. We do topicals, we have a med spa. And so there's always something that we can do to treat that.
Right. And you know what, at the end of the day, that's where Western medicine is a blessing. And I'll use my own son as an example. He's 14, he went through puberty super young, and he's got like god awful hormonal acne all over his body. And it started scarring him. And me, I'm like, I am not putting my son on Accutane or any of the big pharma, right? But he's at the point where I had to do something. And so I had to put him on some antibiotics, some strong dose of antibiotics and a topical. And then he's at the age now where he's willing to cut out the dairy. It's kind of hard for him, if he's at school and such, to know exactly, but he's trying, and, it's the best that he can do, but it is working really well for him. But the hope would be that he can get off of it, continue the no dairy, right? And continue his normal face, morning and nighttime routine, and not have to take the prescriptions anymore.
So something I want to highlight for the people listening, because last week we had Zoe on and we talked about digestion with her, and we were talking about kind of like an elimination diet as well. And I just want to highlight this because I see it so often just in like Facebook groups of people being like, oh, just cut out dairy and gluten. And when you talk to the professionals, they're like, well, we don't necessarily like, cut everything out right away. We kind of go through a process. We see if we can reintroduce something. So for people just listening on the internet, I really want to highlight, before you just try and do this on your own, like, you do not have to just, we want to do this a little bit more methodically.
Right.
Yeah, for sure. For sure.
If you struggle with thyroid issues, you should definitely be watching your gluten for sure, because that's known to
and
cause
autoimmune.
thyroid. Yeah.
Period. Like any autoimmune issues, you have to take the gluten out.
Yeah.
It's highly inflammatory.
But I think elimination diet would definitely come into play with something like that,
yeah,
for sure.
No doubt.
Great. Do you guys have anything else you want to share?
No, I think that, if you are somebody who struggles with hormonal issues or PCOS, I think it's, highly advised that you do get a full set of, female labs done, and don't settle for that. Don't settle for normal, because if you've got symptoms, there's something going on. So if the doctor that you're working with isn't answering the questions, or you're not feeling any better, then find somebody that will help you, because I promise you, like, I've fought my issues. I've helped so many women who've fought like really bad issues, and we've been able to help so many. And you know what? It might take some time. You might not get answers right overnight, but there's an answer for everything. You just need to work with the right person.
Yeah. And you're not crazy.
Yeah. And you're definitely not crazy.
Don't let anybody tell you you are. If you feel the symptoms, they're definitely there, and there's something we can do about them.
Right.
Yeah, definitely be an advocate for your own health. So
definitely.
Sure. So
great. Do you guys want to share where people can find you, follow you on Instagram, or I don't know, MJ, if you have any challenges coming up you want to share?
Well, I'm actually getting ready to launch a challenge very soon, so be on the lookout for that. But you can find me at _you is my Instagram handle, and also MJ Adams 1215. I have to do both because it's just kind of the way it worked out. And then also at Rejuve Wellness.
Yeah. And our Instagram is rejuve.wellness, and it's REJUVE. And then we have a Facebook page, and our website's www.rejuvewoodlands.com.
Yeah.
Awesome. Thank you guys so much. This was so helpful. I mean, I learned a lot. So
awesome.
Thank you for having us.
Yeah. Thank you for having us. And if you ever have any questions, or you have clients that do, just shoot us a message. We're always glad to help any way that we can.
Definitely.
Perfect. Have a good day, guys.
You
Thank
too.
you.
Thanks, Kelly.